Hello, everybody. My name is Amanpreet Singh Vasir, and I'm a medical student from India representing the ACC Medical Student Members community. We're very excited to be here at FitsOnTheGo at ACC.24 in Atlanta, and it's my distinct pleasure to be interviewing Dr. Tamirisa. Dr. Tamirisa is an electrophysiologist at Texas Cardiac Arrhythmia. She's a fellow of the American College of Cardiology and the Heart Rhythm Society. And also, congratulations, she is now the governor-elect for the Texas chapter of ACC. So I think we're really happy to have you here, and thank you so much for taking out time.
Thank you so much for having me.
Absolutely. And I think one of the pressing topics of this interview is physician burnout and how to tackle it. I mean, physician stress, burnout is something which is really affecting clinical practice, patient care. And I think we want your advice as to how to tackle that. But before beginning, I would like to see and understand what exactly do we mean by physician stress or burnout.
Great question, Aman. I don't know if I can tackle anything, but I can give you an overview. Burnout is defined by different definitions, but the most important symptoms of burnout would be the chronic exhaustion, the cynicism, and then those restless nights of sleep, unable to get adequate sleep, and then not wanting to go to work the next day. And, at the end of the day, still feeling that something is lacking, that you have not done your best, even though you've done your best, and then just leading to low productivity. Obviously, these are, some symptoms or some parts of the syndrome of burnout.
I think that clears up a lot of things for us. So we've talking about warning signs of burnout. So can you shed a light about on that a little bit more?
Absolutely. So burnout might not be a true manifestation of depression. There are many definitions for burnout, like I said, but it could be languishing. It would be that, like low tone of stress over long period of time, and just all the coping mechanisms that you had in place look like they're not supporting you, and you still feel like how much ever you're doing, you're just not able to make that goal, make your patients happy, or not able to go to work and feel fulfilled. And then you're not taking care of yourself. And lack of sleep, you and I know, is not great for overall personal health or even work related health. So these all are part of symptoms of burnout, which might not be a true depression. So one important thing to remember, it might be a very low tone symptomatology. It's something, a change in you with a lot of fatigue, exhaustion. That's where you take a moment and question, am I on the verge of burnout?
All right, thank you so much. I think that makes complete sense, and I think the next question that follows up on this is, where does the burnout stem from, and why does it actually take place and happen at the first time? Like, why? What are the causes of burnout? Probably.
Causes of burnout could be external factors or internal factors. External factors is the culture. Sometimes if the culture does not allow the flexibility, culture and the environment is not in alignment with someone's principles of work ethic or just personal, and then the external stressors that come in, whether it's loss of a family member or even loss of patients for us. In that, over long period of time, if a person does not take care of themselves, that can lead to burnout. Internal factors are, as you know, most of us are type A, which is great for the field of cardiology, but putting those pauses, putting some breaks, and then just having those moments of introspection, saying, am I going too fast? Am I pacing at the speed I can, and customizing that speed and the acceleration to yourself is very important.
I think that's it's really does the thing, and we do understand now why burnout happens. So from what I'm understanding, it's an overwhelming feeling, and it has a multifactorial thing related to it. So what would you suggest as to how to maintain this work-life balance? And when we talk about holistic well-being, I think that's something which is spoken about a lot, but it's understood very less. So if we have some customizing strategies for all of us young professionals, people early in career, even faculty, I mean, because burnout is something which is seen very often, and it's really increasing in the medical fraternity. So if there's something we can prevent that with, I would be happy to know about that.
All right, Aman, I'll tell you. Work-life balance is never work-life balance. I kind of not use that term at all. It's work-life harmony or synchrony as much as you can. If anyone truly aims to achieve a balance, it's like an oasis in a desert. You will never reach it. Most of us, they're highs and lows. There are phases in life that we take a back seat, and the phases in life you take the front seat and drive your career or work or life in general. So knowing those is having that North Star guide you as to how to customize the career, the environment, everything around you. While the environment and advocacy is important as an individual person, what can we do? While we are hoping that the environment and everything else is in alignment with your values or principles, I'll tell you a few customizing strategies. And this is not a talk or a lecture. I have done these. So when I had my kids in the early career stage, I worked 4 days a week. And, whether it's someone called it as part-time or not part-time, that's not the point. Is I worked 4 days a week because I wanted time to spend with my children, raise them, volunteer at the school, volunteer in the community. So I customized that time for myself. Other thing I'll tell you is a collaborative initiatives, like you be a part of the team. Please look out for others around you. If you see that someone is, on the verge of burnout or just not being themselves, please be that person. Just take a pause out of your busy routine. Pause and ask them, are you okay? Do you need anything? Engage in a conversation. I'll tell you, for the early career, clinicians amongst us, you all have a lot of energy. There's room for developing mental health groups, support groups within your own community, within your own institutions. Please do that, because talking to each other, expressing, normalizing the communication in that, yes, I am feeling stressed, normalizing that is important, rather than saying, you know what, I can do everything, I'm always go, go, go. That does not normalize and does not open the dialogue. Another thing is, if you yourself is feeling these symptoms, please open up, seek help, whether it's from your chair, your division director, program director, or an attending physician, or someone who's a confidant. Take them into confidence and tell them, and please seek help. And the last thing I'll tell you is be very adaptive in life. This is people who have heard me talk. I always say, you plan your life in a straight line from point A to point B to point C, but you will have a lot of twists and turns, lots of ups and downs. So be very, very adaptable to those, and sometimes let go when you need to let go. Sometimes you need to fight the battles, but please choose those battles wisely, and pause for a minute. Last thing, I cannot stress the importance of self-care. Self-care is very, very important. Work will always be there. Family is something you have to make a priority. Your family is your number one priority. And that's true for me. I don't miss my kids' games as much as I can. And I'm always available to them as much as humanly possible. And I'm supported by a very supportive spouse, and that helps me. So either developing a hobby and exercising, mindfulness, whether you want to go join a Zumba class or do yoga or just go to the gym. Maybe boxing is your outlet for the stress. Please do it and take care of yourself, because taking care of our patients starts with self-care. And that's what I would say, customize to you.
Absolutely. I think thank you so much. I think each point that you've mentioned here is worth of every significance as far as managing burnout is concerned. I think I'm going to take that personal advice as well. I love the way you talked about harmony and not just, striking a balance between work and life. So I think we will definitely all benefit from this. And I'm really happy that, we have these distinct points and we have people like Dr. Tamirisa to guide us. So thank you so much, Dr. Tamirisa, for this. And to watch more videos like this, please check out youtube.com/FitsOnTheGo and follow us on Twitter @FitsOnTheGo. Thank you so much. Thank you.